Well, thank you, APOD, for inviting me. Thank you for being here. Protocol observed. I got to do this very quickly, so we're going to go. I'm going to not try to go into repetition from what a lot of the speakers have spoken about today, so I'm going to give you a couple of things that might be a little different that we're doing. On our first slide, we can see the healthy guide for living, different than what we're used to in a food pyramid or a plate. And especially tested with kids and young adults to see, a plate is very, I don't know anyone that's eaten kind of the way the plate is divided, or looks at a plate and has is able to memorize how it's divided. With the pyramid, just to give one of the examples why they're less effective. With the pyramid, a lot of these countries, my country, Egypt, where there's pyramids, in Latin America, Mexico, we have a lot of dogs. And at the bottom of pyramids, guess what dogs do? So anyway, so all these connotations, this is just to see who's awake here, have led us to develop a whole new symbol, something that kids can understand, 5 sails. It has the food energy balance in there. The boat, the anchor of the boat, is actually a symbol for breastfeeding. It's where we start. We talk about the environment, because you can talk about the environment. And then on the bottom, we really look at the family exercising together. That's why the dog's in there and everything. It also has an emotional, psychological side to it, of the family coming together. And all in all, what really creates the difference here is that we can take this symbol and introduce it to a whole new level, the power of play. And what I'm talking about here is a new level of education, a new platform for education. I think a lot of the things that we're doing lacks a new platform, and the new platform of education is gaming. So this thing becomes actually a live game with pirate ships and etc. We're not going to go through that, but it's just to give you an idea of what we're doing with the power of play. And as a way, in creating such a game, we're able to mass disseminate this to all the schools and not have to teach the teachers one by one or teach the kids. In the power of play, you're able to actually move through the whole gaming side of it and teach yourself while you're actually doing the game. So it has a lot of benefits in that sense. We're looking at, if we look at what's happening in Aruba real quickly, with the kids, 36% overweight, adolescents, we're looking at 41% in 2021 on the obesity. Adults, we're looking, oops, went too quick. Okay. With the adults, we're looking at 81%. So, Aruba is almost a little Mexico in that sense. We're really having a huge issue there, and we have universal care, just like the Netherlands. But what are we doing with this? What's the change? Well, our primary care, all our house doctors are on electronic file systems. We're one of the first countries to do this and implement this, and this creates a difference. Secondly, what we're introducing is a social media that also works on cell phones to the whole population in educating them. So it's creating new platforms and educating on new platforms that's making the difference. We see an increase in movement, and we're also introducing exercises medicine into the electronic dossier, into the file system, so that physicians have to be re-educated. We're also talking about the education of physicians, that they're only, nutrition is half an hour maximum, physical exercise or movement in their education process is close to nothing. These are issues that we need to take up with the different universities and have these changes implemented. The perception is what we're working on. Front of label food labeling, especially in a country that imports from so many parts of the world. This becomes an important, and the sailboat works incredibly easy. We've adopted kind of a CIDEL system of choices, making it just, what is the healthy choice in this case. We're We're being a little bit inventive. We've designed a movable office that has in it a DEXA scanner, blood work capabilities, and really it's the Carmen bus, specifically geared for NCDs that goes around the country and measures everyone. On that bus, there's also an electronic system, eHealth. We upload every patient we see and we study them immediately. So as we do screening and health promotion, the screening is to shock them. Really, the DEXA system, they get their whole body mass index out of there, they see it, they have a visual of it, they get their blood work next to it, and they go into breakdown. And as they go into breakdown, we go into breakthrough with them by educating them on what the steps are that they need to do differently. And this is really in the community, the health going towards them. Here we have the Aruba call to action, which was our first PACO event. If you get a chance to read it, go to the site, paco.aw. You can get all the information that we have there on this. To finalize, I think, just like was said here before, getting the stakeholders together, but really having one center, and that's what created now. That's what we've created now is IBISA, the Institute for Healthy and Active Living. And this center only focuses on lifestyle change. So it becomes the center point for all agencies, NGOs, everyone, including infrastructure, including everything we do as a country or outside the country, to come together and get coordinated here. So we have a central coordinating and also a translating office, because guess what? When sports talks to medicine and medicine talks to infrastructure, we all use different languages and we can't communicate. So getting over that communication hurdle is this institute that puts everyone together. I want to thank you all and hope that was informative, and if you have any questions after this. Thank you very much.